Hi, everyone, and welcome back to Dogs Do Speak podcast with myself, Samantha Wayland. And today we have the wonderful guest, Clare Grierson. And Claire will be in a little while talking to us about pain in dogs. What is pain and how do we detect it? And when we do detect it, what should we do? So, without further ado, welcome to Dogs Do Speak podcast, Claire. How are you?
Thank you very much. Nice to be here again. Nice to see you.
Excellent. Claire, can you just tell us a little bit about yourself, how you came to become a dog trainer behaviourist, and what it is you actually do?
Okay, I came into the industry just over 10 years ago. It was kind of by default. My mum was really into her dog training, and I was brought up by parents who just weren't happy unless we had multiple species within the house. So I was always around animals and have always loved animals. So yeah, just over 10 years ago, I really got heavily into the industry and got hooked straight away. I absolutely love working, particularly with dogs, but all species really. So I do behavioural consultations, I do one-to-one training, I do group training, I do agility, I do scent work, I do canicross. It's 24/7, but I absolutely love it, and I love learning and sharing the knowledge that I come across through some of the most amazing people in the industry. I think we've got some very, very clever people in this
Yeah,
industry, and I think we're blessed to have this knowledge and to be able to share it.
I totally agree with you. We've got some wonderful people in this industry, although sometimes it feels not.
Yes, we got some not so wonderful, but hey, that's the way of the world.
It's
Never
the
mind.
world, and that's
Yeah,
another topic for another podcast.
yeah. Very long podcast probably, but
Um,
let's not give them our energy. Yeah.
so let's think about pain. I mean, can you tell us why we need to think about pain when we're working with dogs or before working with dogs?
Okay, yeah. I mean, I find it very, very difficult to work with any dog without having one eye on the pain aspect. And we know from research that was carried out by Dr. Daniel Mills of Lincoln University that 80% of behaviour comes from can be down to a pain or a medical issue. And I can't help but totally agree with that. I think there's environment that affects behaviour, but that is internal environment as well as external environment. And as not Linda PK, Susan, oh my goodness, what's her name? Hart, very well known trainer in America that I can't remember her name.
Garrett, Susan
Yes,
Garrett.
yes, they would say behaviour does not happen in a vacuum. And that is totally the case. Behaviour doesn't happen just for the sake of it. One of the dogs can't talk to us, but they can tell us that there's an issue through their behaviour. And that is so much more reliable than any physiological tests that we can do. So it's really important that we get to know our dogs, get to know how they present when they're well, so that we can really pick up on what's going on when they're not well. What's changed, what are they doing differently, how are they moving, what does their gait look like, what does their coat look like, are they making a huffy noise when they're getting up and down, are they refusing to get in the car, all these little signs that they might be giving us that actually all is not well. They're not going to be doing that just to be bad or just to be stubborn or just to annoy us. We have to think, hang on a minute, what is going on for that little dog? What can we attribute this behaviour to, and be a bit of a detective, really. Yeah.
So, in other words, then what we're looking at is, 'cause I see this in two different ways. We have people with the skill sets that we have as trainers, behaviourists. Yeah, we can
Yeah.
notice certain differences, but for the public, the dog owner who is not a trainer, not a behaviourist, are we sort of saying that any sudden change of behaviour should be looked at?
100%. And I think this is why, as well, when we start a behavioural consult, we need to start with the vet and make sure that dog is thoroughly checked over by a veterinary before we get involved, because it would be very easy to go down the wrong path. And if there is a pain issue and we're trying to get a dog to, for example, sit, but actually this dog's got bilateral hip dysplasia, why are we trying to make that dog sit? So I think we always need to start with a clear, kind of, as much as possible, a clean slate in terms of medical and physical health. Otherwise, what we're doing can be more damaging or not helpful. I mean, the other thing about pain issues is, if a dog has pain issues, they're not able to learn. They're going to be in a situation where they actually can't learn, and then we're wasting our time. So I think it's really important that they get that clean bill of health before we get involved. I mean, one dog I worked with had sudden sort of onset separation distress. And it was very clear to me that there was something else going on with this dog. Why would it suddenly have separation distress in its later years? I can't remember how old this little dog was, but she was getting on a bit. And it turned out she had thyroid issues. So, I could have sold them this big kind of separation distress program, and we never would have got anywhere. So for me, it's very difficult to work with the dog unless they've been assessed for pain first.
Do you find that a lot of your clients take that on board and go for the full vet check, or are they saying, oh, my dog's not in pain, they're jumping off the furniture and running around the garden? They wouldn't do that if they were in pain.
100%. Yeah, a lot of the time they will say exactly that. And I think it's I'm a dynamic dog practitioner as well, and through that I've learned how to kind of identify sort of gait and pain issues within the way the dog moves and postures. That's helped me kind of communicate what I'm seeing a little bit better. But obviously we have to be really careful how we communicate, and because people don't want to think that their dog's unwell or in any amount of pain. So I think, as much as possible, we need to kind of encourage them to go to the vet first, so the vet, we can't diagnose anyway, but so that the vet can kind of cover that off with them. And just in a way, just saying, you do realise that certain things can affect their behaviour, and we just need to tick that off. But yeah, 9 times out of 10 they'll say, oh, there's nothing wrong. But if that's the case, you kind of have to start working with them, but slowly introducing, oh, that could be related to that, or well, that could be related to that, and kind of give them a menu of options as to why that behaviour could be happening. And I do find that after kind of an hour of very kindly pointing things out, normally they'll go, okay, you know what, I will go and get that checked out. Because at the end of the day, people want to help their dogs. Most people want to, see their dogs be well, and to get they normally come to you because the behaviour is so pressing. They can't live with it anymore anyway. So I think it's through education and through gently educating the client about their dog as you go along, rather than being very like, well, you need to do this and you need to do that, and your dog's that, it's about building that relationship and that dialogue as you're working with that person and that dog. Oh yeah.
You hit on a really, really important point, that the dog is not ready for learning. And I think that's one of the reasons why people get in touch with professionals, because they're not being able to get that desirable behavior, whatever it is they're looking for. And then we go along and we realize that it's not happening simply because if we're in pain, it can have an impact on how we behave.
Yeah, 100%. Yeah.
I know that in the last month or so, I've been sheer hell to live with since I've had sciatica. And I've been blown.
Can't imagine you'd ever be hell to live with, Colin. Not ever. Not in a million years.
Alison will say you're different. Even Bailey will tell you different in the last 4 weeks. Every time I move, and if someone speaks to me, I get the ump. So if we've got this and we're in someone's home or they're in our class and we see that excitable puppy and they're asking that puppy for a sit or a down or a stay, but the puppy is just all over the place, would we consider a possibility pain could be at play here?
Absolutely. Some dogs have had pain issues since they were little puppies. And these puppies can present as being quirky or reactive or unpredictable or anxious or stubborn. And it's not. There's something inherently not right, so yeah, 100%. And actually I think it was Dr. Sophie Bell said on a webinar recently that 20% of dogs can have osteoarthritis before they're one. So I think we've really got to kind of be aware of this. And lots of dogs that pull on the lead, or or kind of barking and lunging, and kind of really over the top dogs, or really energetic dogs, sometimes it's too painful to stay still. So they're moving about to try and relieve pain, but also to kind of really drive up adrenaline levels, because adrenaline masks pain. So a lot of these behaviours become massively and stringently reinforced because it's helping them cope. So it's not just, painful dogs aren't just dogs that won't move or sit really still or react if you try and touch them. These manic dogs can also be really highly excitable for pain issues as well. So it's very difficult to work with a range of dogs and not always be looking. You've always got one eye out for the pain issues or the medical issues. You just got to, because why would dogs behave like that in a maladaptive way if they weren't trying to change something about their environment, external or internal? It's all about that. So for me, anyway, yeah.
Totally agree. So, in other words, regardless of whether we are dog owners or dog trainers, we need to understand and educate ourselves into a point where, before we look to do any form of training, we need to be saying, is this dog ready for learning? Is this dog in the right place mentally and physically before we start doing any kind of training? But how do you get that across to an owner?
Yeah, I think it's all about data collection in the first instance. So having a very sort of strong ability to ask the right questions, put the right questions forward. So even before you see the client, or during the first initial stages of working with that client, you've built up a picture of where there may be potential issues. So think questions like, do you have what flooring do you have at home? Does your dog like to travel in the car? Things like that can kind of paint a little bit of a picture and give you a little bit of a background as to where there may be potential pain issues that you need to keep an eye out for. But I think all of us should have the protocol of, we don't see dogs unless they've been to the vet. But I understand sometimes, especially if they're coming to you for training, that's not necessarily helpful or appropriate. But yeah, I think it's all in that data gathering beforehand. And also, I often, before I work with clients, ask them just to send me videos of their dogs, just normal videos of them doing their stuff. And from that, sometimes you might actually pick up on something, but then it's about very gently communicating that, what, sometimes I've seen dogs in the past that might be X, Y, Z, and it's turned out to be ABC, so maybe it's worth checking out, checking that out before we start working together, so that we can be sure it's not down to that. We are in the business of education first, I think. We are educators, and we have to put that at the forefront, and help people to understand the various different reasons why their dogs might be behaving in the way that they are. It's not a silver bullet. It's not, I think, there's no magic wand either, is there?
No, if only there was a magic wand.
If only.
I mean,
A millionaire. Yeah.
Again, you've touched on another thing, that the home environment is a good place to start looking as to what could possibly have triggered this pain. And slippery floors. We know what slippery floors can do. We know when you're playing with your puppy or the dog, and they're running from one end of a room to the other, and they bash into the wall,
gliding along after a ball or a toy.
Absolutely. These are areas where pain can be triggered.
Also anxiety.
And anxiety. So what we're saying is by getting good, constructive information prior to looking and working with. We should also take a view of looking at the home environment, what their exercise is, where they go, the types of places they go. And until you said anxiety, separation anxiety was the case that you had, you've now given me another angle, what I'm going to start looking for in older dogs. Yeah. So thank you for that. Yeah. How do you manage the bit where, let's just say we've gone to the vet, they've done a physical check, they've done the bloods, and the bloods have come back okay. The dog is still in that, that sphere of
place.
that place. Yeah. How do you manage that? What do you then do?
I think we've got to understand that there are different types of pain. So there's visceral pain, which is like gut, intestines, kidneys, liver, like a dull, achy pain. There's somatic, which is bones, muscles, tendons, ligaments. Neuropathic, which is spine, spinal cord, nerves, trapped nerves and things like that. So we have to be mindful of what tests the vet has run and what they're looking for. And it might be that they're looking, I mean, they're the experts, but they might be looking at it from one angle, but actually there's something else going on. So I think it's worth understanding that there are different types of pain, and different types of pain will need different types of treatment, and different types of painkiller. Then you've got the individual factors. Certain painkillers don't work for all individuals, and also, how long the animal is on pain meds. So if I think there is a pain issue and the vet has done tests, then we might ask the vet to do more tests. So they've done a blood test. Well, what about an X-ray? What about an MRI? And then what I often say to people is, look, if we can do a pain meds trial, then we might be able to see a change in behaviour that would, sort of deem us being right, that there is a pain issue. That's if you can't detect it through looking at their acts of daily living, or through their gait, or through their posture, or any of those other things. You might be looking at their coat, their paws. So you might ask for a pain meds trial, but that would have to be for about 8 weeks. The difficulty is that not all pain meds are equal, so you might have to try different pain meds. But anything less than 8 weeks, then you may not see a change in behaviour. The dog might be acting for they might have had a learning history of this behaviour prevents that pain. So you've kind of got to do it for long enough for the dog to realise actually that doesn't hurt anymore. But also, if you're doing behaviour modification, you have to be helping the dog on those pain meds for long enough for that behaviour modification to kick in as well. So it's a journey, and it's a journey that you have to be on with the owner and with the vet in triage to make sure that we're sort of ticking all the boxes. So it's not always obvious, and sometimes it will mean that you're backwards and forwards to the vet, trying different things, doing different tests, doing different imaging, but yeah, it's worth it in the long run, because if you can get that pain managed, then you've got more chance with your behavioural modification, and then at the end of the day you've got a chance of success. But yeah, it takes a little while.
Yeah, that's really interesting, because that was what I was going to ask actually. It's how long you would sort of say for the pain med trials, because do you find that you work well with vets locally? Are they sort of receptive to you sending people their way? Because I know I've had vets sometimes just go, oh no, they seem fine. Or if they do a pain med trial, I've had a couple who've got pain meds for 2 weeks, and I'm like,
yeah, a lot of the time the vet will give a limited amount of pain med, because what they'll want you to do is get their liver and their kidney function checked before they prescribe for longer periods of time, because obviously they don't want to be giving something that's not going to work. So I think a lot of the time that needs to happen with those bloods. But I think it is hit and miss. I think you've got to be prepared and be willing to. Well, the client's got to be willing to kind of try different vets until you find one that you're comfortable with and who's at least willing to have that dialogue with you, and they are out there. But I think the more you can sort of give them information that is useful, bearing in mind you get 10 minutes, give them the information that they need. Take videos in, take data in. This is where dynamic dog's quite useful as well. Go in with stuff that the vet can go, okay, no, I can see what you're looking at now, or I can understand why you're asking for this. And I think it's worth getting a double appointment as well. Don't just go in there for your single appointment and expect, to be able to have that conversation in entirety. But go in there knowledgeable. Go in there and kind of give the vet half a chance to understand what you're seeing, because they're not living with that dog at the end of the day.
Really to sort of support the client advocating for their dogs, I suppose, as well, isn't it? Just not sort of going, okay, and walking away at the first hurdle.
I think be confident in your knowledge, be confident that you have done a good job and that you've got the data, you've got the knowledge. And if you're not sure, refer to somebody who has got the knowledge to be able to advocate for that dog. Because at the end of the day, we cannot help that dog if we've not ticked that box.
Yeah.
Because as we said, they're not gonna be in a position to be able to learn or do anything different if they're struggling with pain, and pain stopping them from sleeping, and not sleeping is making the pain worse. It's just a vicious circle, really. So yeah.
So you've mentioned dynamic dogs a few times.
Yeah.
Tell us a little bit more about dynamic dogs.
Yeah, so a friend of mine, Gemma Harvey, created Dynamic Dog. It's probably a lot longer than I realised there, probably about 5 years ago. But it's a great training course, and it's very, very thorough. She's a very thorough person. But you have a look at how behaviour can change if there is a pain concern. And what she does is she teaches you to be able to identify that, but also to prepare a report that the client can then take into the vet, which kind of makes it very easy for the vet to be able to look through that and go, okay, no, I understand what you're seeing now. I understand your concerns. And it's, she teaches you how to kind of put that into veterinary language as well. So it's very easy for the vet. And the idea is that we can present information in a way that the vet can go, okay, I can diagnose that and I can offer you this treatment. So it's not up to us to diagnose or to suggest what should be done. That's obviously all down to the vet. But we can at least help people say, this is what we're seeing, Mr. Vet. Because dogs, when they go to the vet, will freeze. They have adrenaline that masks pain. They don't present the behaviours that we're seeing at home for all, for many, many reasons. And so it's impossible sometimes for the vet to be able to understand what we're seeing, unless it's obvious, like there's muscle wastage on one hip, that would indicate that the dog's not waiting on that hip, or the paws are unevenly scuffed, or the coat's not sitting properly. Some of those more so obvious but more visual things that you don't have to see the dog moving about or doing sort of daily active living. Those are more easy to pick up on, but we can compile all of that into a report so the vet can go, okay, got it, okay, let's try this, and you get them on side that way by kind of helping them help us, really. Yeah.
So whilst we're on the Dynamic Dogs page, can members of the public join such a group or get?
Yeah, there is a Facebook group that anyone can jump on, and there's discussions on there, and information is put on there to help people, and then from there you might want to join and do the course and become a practitioner. But yeah, there's a free Facebook group for anybody who's interested.
Okay.
Yeah.
What I find a lot of clients, mainly clients, they worry about finances. So we can see that they are worried about their dog's behaviour. We've gone along and we've explained to them what is a good way to go, the full bloods and the physical checkup. But they worry about finances. would I be right in saying that if we're looking at behaviour here, they will be covered by their insurance, or hopefully be covered by the insurance, so they shouldn't have to worry as much?
Yeah, it all depends on the insurance company.
Yeah, yeah.
Some they're not all equal. But I think when most people take out insurance, they're not thinking about behaviour. From my experience, they're thinking about medical and veterinary. They're not necessarily thinking, hang on, there might be a behaviour issue that is connected with this. But I think most insurance companies do cover behaviour in one way or another. Yeah.
So we've got pain. We've gone to the vet. It's come back. We've gotten the pain trial. Let's just go down a route of the 8 weeks. 9 weeks later, dog comes off, and the client says, "I have noticed that there is a slight difference there in the actual behaviour where they're not. What's the word? They're sitting straight, for instance, or sitting straighter than what they were a few weeks ago. But I can still see there is something wrong." Yeah. Would that be where the MRI or the X-rays would come into play?
Yeah, I mean, you may always have to go back and get other tests done, particularly if tests have been non-conclusive. I would say in terms of pain meds trial, it may be necessary to continue the pain meds, further into the future while you're still working on the behaviour modification. And for some conditions, they may be on pain meds long term, so particularly chronic conditions such as osteoarthritis and things like that, that are never really never gonna get better per se. And you might then look at other kind of ways of supporting the dog, such as hydrotherapy or laser treatment or acupuncture. So yeah, you'd be going back to the vet, I think, until you got the dog to a level where you thought, well, you know what, they're comfortable. There's nothing really more we can do to support this animal. Or unfortunately we can no longer kind of spend money, unfortunately, especially in these days. That could be a thing. And then when you get to that point, just making sure that the home is set up so that they've got a nice safe place where they can get sleep, making sure you're using ramps to help them, making sure you've got those rugs down. What else can we do at home to ensure we're supporting that animal, making sure all the family are treating the dog with respect and not expecting the dog to do things that they shouldn't be doing, making sure their exercise is appropriate, that we're not asking them to chase balls when we know they've got osteoarthritis, all of those sort of things we can do to really support the dog moving forward. So there's a lot we can do to change our lifestyle and change their home life to support the injury, depending on what it is. Definitely. Yeah.
I love the way you mentioned lots about the home. For me, sleep would have to come into play here as well.
Yeah.
Ensuring that the places where they sleep is traffic free, extremely comfortable, especially if it's arthritic.
Yeah.
Um,
Making sure they can stretch out, making sure they can regulate their temperature. Some dogs like to be on a raised bed. All of those little things, we can make such a difference to how that dog feels generally, let alone the pain issues. But are they comfortable at home? Or are we creating anxiety around them? Because anxiety is going to make them tense, which is going to put stress on their muscles and joints. Temperature, even temperature. If it's cold, it's going to make joint pain even worse as they tense up, and we're restricting blood flow. If it's too humid, tissue can swell. So, making sure temperature is controlled as well, it goes a long way. Yeah.
You mentioned earlier as well about car journeys. Is your dog okay in the car? Tell us a little bit more about where you sort of see signs of pain around car journeys as well.
Cars are amazing. If you think about it, the dog's got to get into the car.
Yeah.
So if there's any pain issues, you might find the dog go, I don't want to get in. Please don't make me get in. Don't make me get in. And then you get the dog in the car. And then those tiny little micro kind of movements are putting pressure on muscles and joints, which can create not just pain, but anxiety. And then you get a dog that's drooling because the perception of pain is going to make them feel sick and anxious. You get younger dogs that have got pancystitis. The larger breed dogs that are growing, they're going to get growing pains. That could really set them up to hate the car. If we put them in the car and they're feeling pain on a journey, in the future, when the pain's gone, they could still have that associated anxiety that is then going to make them car sick. So cars are a nightmare as far as I'm concerned. I think it's very important that we make sure we're setting dogs up to be as comfortable as possible, and that's up to them to determine, not us always. Because there's multiple things that can go wrong in a car for a dog. Yeah,
that's really interesting. I don't think I would have thought about that side of it. I would be thinking jumping in and out, of course, but I wouldn't have thought about the little bits. That's really interesting.
But also, if you think about balance, the vestibular mechanisms in the ear, they can feel unbalanced. It's there's a lot going on, and they might have hearing issues if you've got your window open and the car's going boop, 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 boop. Sense of smell and an air freshener. Oh my God, we're just. The cars aren't great for dogs. I don't think personally.
It makes sense, because a lot of clients will say, "Oh, they're okay on long journeys on the motorway, but when we're in locally, but of course, if you're stopping and starting and stopping and starting, you've got more of those jumps, which is creating
potholes." Potholes.
I've got loads of them.
Sleeping policemen and turning around corners, and it's not ideal. It's not great for them. But I think making sure that they can lie down flat and then they can stretch out as well. And some like to face the direction of travel, some aren't so bothered. Can they see out the window? Is that causing anxiety? Dogs will make an association. So just as a dog that is kind of yanked back on a collar when it sees another dog or a jogger or something like that, if that hurts, they'll make an association with that trigger because of the pain. Pain is very much linked to emotion and memory. So it doesn't happen in isolation. Pain is very much associated with that because it's survival. If we remember what hurt, we're going to avoid it. So dogs that get hurt, feel pain in a car, looking out a window, seeing somebody walking down the road in a high vis, they're going to make that association potentially. It's all association. Dogs learn by association. So yeah.
Whilst you were talking there, Claire, it just reminded me of about 5, 6 years ago now. A client I was working with their dog, we had to look at changing the diet because the dog just couldn't cope with the kibble anymore. They were in pain, and the vets could never really find exactly where this pain was coming from. But when they changed the diet, the dog ate more comfortable.
Yeah.
But when they were eating kibble, they were stopping and starting. You could see them shivering and trembling. There was some kind of discomfort.
Yeah.
And so they liquidized stuff. The dog's never ever shown those signs ever again.
Yeah. I mean, gut pain is massive. And there are two guys that I absolutely adore, and I don't think we can get enough of them, and that's Dr. Vince McNally and Dr. Connor Brady. I think they're superb people, and I love them to bits for their education. Not personally, they wouldn't know who I was. But anyway, I'm forever referring people to them because, gut pain is massive, and we know gut pain and gut health is very much linked to brain health, the microbiome and serotonin and all of that kind of stuff. So, gut pain is huge, and lip smacking or holding a bowel or freezing in that sort of bowel stance can be very indicative of there being gut issues. But imagine going around with gut ache. But a lot of food, all dogs are individuals. So I think the better quality food we can give an animal per calorie, the better. We've got to be mindful of their gut health. The other thing that we must take into consideration is the weight of a dog, because, and it was Dr. Sophie Bell said this again, a dog losing a kilogram of weight can be the difference, could be the equivalent of giving that dog a painkiller. If dogs are overweight, the amount of pressure they're putting on those little joints, I don't know why all dogs are little with me. Those big joints of that amazing massive dog, that can really make a huge difference. And I unfortunately see lots of overweight dogs, and I can see that they're in pain, and the owners are like spending out on pain meds and hydrotherapy, and not hydrotherapy, normally pain meds. But if only they would just reduce the calorie intake, or put the dog on a really good quality food so the dog is getting the nutrition that they need for less calories. Then we see a massive difference in the well-being of these animals. It's get the weight off them, and we're really relieving a lot of pressure and a lot of pain potentially.
Yeah, I find that a lot of clients think that it's almost they're caring for them, because they're like, oh, I'm giving them this and I'm giving them
another biscuit.
I'm just fattening them up. It's good. And just it's just as bad as them being too skinny. Just keep them in the middle. That healthy weight. But I think it's that education, isn't it? That they're cute and they're cuddly, but they're actually suffering because they are cuddly.
It's too heavy. Yeah. But also some foods we have to feed more and more calories to the dog for them to get the nutrition that they need. So the better quality food, the better they're going to be. I always say to people, spend the money on the food and not the vet. If they're getting good nutrition for less calories, then you're getting a nice lean dog with hopefully less pain issues for later on in life. But yeah.
I totally agree with the later on in life bit, but I was looking at it from a different angle as well. The overweight dog who we're throwing that ball for, which owners do, then has ligament damage, etc. Because of the weight. Had it been at a good, useful weight, let's say, that may not have occurred. So being overweight does not help.
No, absolutely, it doesn't. It really doesn't. So yeah, I'm not a fan. I know there's a big debate about ball throwing going on. Unbelievable. But what?
I shouldn't have said that. I'm sorry I mentioned it.
Yeah.
What have you done?
Right. Well, look. I've got many reasons why I don't like ball throwing. I think everyone's individual. All dogs are individual. They all need different things. They're all different breeds. They've all got different breed traits. All of that aside, if you've got a dog that's in pain and you're throwing a ball, that dog will be motivated to chase that ball. And the more they chase that ball, the more their cortisol is going up, and so is their adrenaline. And the adrenaline will mask the pain. So they will continue chasing that ball, no matter what damage that is doing to the dog, they will be motivated to do it. So I think ball throwing, great, fill your boots, but be aware of any underlying medical or pain issues your dog might have that are not going to be being helped by that. And also, as a person whose kids, and I blame the kids, not me, threw a ball for my dog, not often and not much, but my dog has got a shoulder injury that is playing up now at the age of 13 that he did when he was 2, chasing a ball.
Yeah, I think there's a huge difference between teaching a retrieve to a dog.
I love teaching
throwing a ball up and down the hallway, and they're slipping and sliding on the floors, and they're crashing into furniture. There's a massive, and I think that's where the argument is that it's okay for them to go and get something and bring it back to you. That's great.
I love
let's do it somewhere else, and let's do it on different flooring, and so I think that, and that's the only thing I'm going to say about that argument. I'm not
exactly, but a dog jumping up, a dog jumping up to catch a ball and then landing and twisting, that's the equivalent forces of a crash test dummy. You can't do that without the forces going through the body of the dog. And also, I think I'm right in saying, and I can't remember, so I can't quote who said this. If I find it, I'll send it to you. But I remember, I think it was Dr. Amber Baston actually, saying on a webinar that quick kind of ball kind of exercise is not natural for dogs, and it actually raises cortisol. So do we want to be raising cortisol on a daily basis in our dogs? And shouldn't we be leaving 72 hours for that to then dissipate? I think we're creating really kind of like wired dogs through that. But anyway, yes, enough about the ball. Let's not get into that.
I'm very glad that I'm old school because I still use the dumbbell.
Love a dumbbell.
None of my dogs have had to chase a ball. And if they, okay, Zara did, but it was a busted ball that was pushed in together and it was dead once it hit the floor. Yeah. So I totally agree with you on the ball side of things. Claire, it's been an absolute pleasure. Your knowledge is just absolutely brilliant and fantastic.
Thank you.
If anyone wants to use your services, how would they be able to get in touch with you?
I'm on Instagram, I'm on Facebook, I'm on everything, on LinkedIn. Send me an email at claire@muddymutleys.com, and it's Claire without an I and Mutleys with one T. But yeah, I'd love to hear from anybody who'd like to know more. Thank you.
Yeah, it's been brilliant. Thank you.
No, thank you. It's been really good fun. Lovely talking with you both.
So, everyone, that's the end of our discussion for today. Please hit that submission button. I always get that bit wrong. Submit button.
Subscribe.
Button. Hit that subscribe. So you don't miss any of the podcasts that we put out on a daily, more or less a daily basis. So until the next time, we'll speak and see you soon. Bye for now.